Hi, my name is JC Udi, and I will be doing my medication administration. Here are my papers, nothing written on them. Clipboard. And here's my work area. Sorry, my phone's on the charger. Here we go. Everything here. Sorry. And laptop's just here to hold up my phone. Okay, I have Kate Yano, and the first thing I would do is compare the home meds to the meds that the doctor has ordered. So I see at home she's taking aspirin and NPH. In addition to those, the doctor would like for her to take furosemide, hydromorphone, and humulin R, and he also ordered a PPD skin test, one time only, to rule out TB. So the 6 rights to med administration are right patient, right dose, right drug, right time, right route, and right documentation. I will do 3 med checks, 1 at the cart, 1 at whatever I'm preparing the meds, and 1 at the patient's bedside. Okay, so my first med check. All right, furosemide, 60 milligrams per tab, expires 6/23/22. I will be giving 1 tab. It's PO. Then I have aspirin, 81 milligrams per tab, expires 5/26/2020. PO, I will be giving 1 tab. Then I have hydromorphone, 2 milligrams per milliliter, given IM, 5/26/2020, and I will be giving 1 milliliter every 4 to 6 hours for pain in left foot. And then I have the PPD skin test, 1 time only. I will be giving, it's 5 tuberculin units per 0.1 milliliter. This is given intradermal, and expires 6/23/2020. And like I said, we'll be given 1 time to rule out TB, and I will give 0.1 milliliters. Then I have insulin regular, or humulin R, 100 units per milliliter, expires 8/12/2020. Given sub-Q per sliding scale, I will be giving 2 units due to her blood glucose being 191. So now I'll do my second med check. I will do my hand hygiene here, and this is where I will be preparing my meds. The furosemide is given to drop her blood pressure. Her blood pressure is 166/88. Her potassium is 3.9, so that's a normal range. All electrolytes are in normal range, so that's okay for the furosemide. And yes, the furosemide and insulin. And then for the aspirin, the plates are 129,000, which the regular minimum is 130,000, but we'll go ahead and give that med. Just make sure that we watch those platelets and that they don't drop below 100,000. Hydromorphone, giving it for the left foot pain that she explained as throbbing, and on the pain scale, 5 on the pain scale. So we will give that for pain. Respirations are 18, which are fine to give the hydromorphone. We just have to watch and make sure that they don't drop below 10. If they do, we have to hold that medication. And what else do we have? Tuberculin skin test, doing that because she stated that she had a productive cough of yellow blood tinged sputum. So I want to rule out TB. And then we have our insulin regular. Blood glucose was at 191. So according to the sliding scale, we'll give 10 units. And she is she has past experience of CAD, type 2 diabetes, and hypertension, renal insufficiency, so it explains why her bun and creatinine are slightly elevated. Yeah, so she was admitted for her left foot diabetic ulcer. If I didn't mention that earlier, I don't know if I skipped over that. But now I will give my meds, or prepare my meds. So my hygiene. Hand hygiene. First, we have our furosemide, which we already checked. So we will insert the 1 tab in there. And then we have our aspirin, which we checked. So 1 tab as well. So there's my there's my pills there. And then I also, we're going to do our hydromorphone, which is in its container still. It's a 3 milliliter syringe. We will attach our 18 gauge filter needle, 18 gauge 1.5 inch filter needle. If this was my hydromorphone, it would be a glass vial. I would tear it on one side of my alcohol pad, put it on top, and break it at the black line away from me, disposing of that into the stripes container, still keeping the vial, and I will draw up. I would not need to clean because it would be broken, but I will draw up 1 milliliter from here, making sure there's no bubbles. Okay, I have my 1 milliliter. I will recap by using the scoop method, but I will then get rid of this filter needle here, put it in my sharps. Okay, and I will attach my 22 gauge 1.5 inch needle, and this is what I will use to administer this hydromorphone. I will then label it with medication and dose, and that is ready to go there. Okay, and then we have our PPD skin test. This is a multi-dose vial. I will clean the top. I have my tuberculin syringe here. I will insert air. The amount of air I will insert will be 0.1 because that is the amount I have to draw up, but I will do the air first. So I have my 0.1 of air. I will insert here, invert, draw up 0.1, getting rid of any air bubbles. Okay, recap. And this is a multi-dose vial. So then I will label this with med and dose, and now this is ready to go. Now I have my insulin. I have my insulin syringe, also multi-dose vial. I will clean the top. Per sighting scale, 2 units. So I will draw up 2 units. Insert. This is high alert, so I will have a second nurse check. I will draw up my 2 units. There. Okay, recap using the scoop method. If I was to, and I will label with name and time here. If I was to be mixing insulins, I would first roll my NPH, insert air into NPH, then insert air into Humulin R, invert Humulin R without taking it out, invert Humulin R, draw up the prescribed amount or the ordered amount. Then I will stick it back into my NPH and draw that up as well, being sure that I'm getting second nurse check during all of this. And be sure to do the around amount of cloudy because you cannot push that back in. You would have to start over with a new syringe and new needle. Everything like that. Okay. I think and the insulin because she has blood glucose of 191 if I didn't mention that earlier. Now I will do my third check. I will knock on patient's door, introduce myself, do my hand hygiene here. I will compare her name and date of birth to the MAR, looking at her bracelet. There, looking. So, let me get this on. And I will also look at allergies. So, looking at the MAR, bracelet, everything matches up. She has no allergies. This is Kit Lano, so we're good. So now I will tell her a little bit about these medications so she understands. Ms. Lano, today I'm going to explain all your medications that we're going to be giving you so that you understand what you're getting and why. You will be taking the furosemide to decrease your blood pressure because your blood pressure was 166/88. We pre-assessed your potassium, so that's okay as well. All your electrolytes are in order to give that. What the furosemide is going to do, it's in pill form. It's going to get rid of the excess water. that will in return decrease your blood pressure. But to be looking out for, it will increase your urine, but that is totally normal. So to increase your urine and decrease your blood pressure, this drug can make you dizzy. So make sure that you rise in stages slowly. We will come back and evaluate your blood pressure, and it should be dropped if the medication is working, and your urine should be increased. Okay, now your aspirin. This is a med you take at home. You know you have a past history of CAD. We want to prevent those blood clots and continue to do so. But remember to let us know if you have any bleeding in your gums, any tarry stools, any coffee ground emesis or anything like that. You need to report those to us immediately, please. With your aspirin, we assessed your platelets and your coagulation panel, which is your bleeding time, so it's okay to give all of that. And with aspirin, you will, as you know, continue to take it with food so it doesn't cause any of your stomach upset. Now your hydromorphone, we'll be giving you this for your pain, but I want to ask you, earlier you said that your pain was, in your left foot was a 5, and it was a throwing sensation. Is that still the case? Yes? Okay, so we will be giving you your hydromorphone to relieve that pain. What to know about this medication is it can make you drowsy and dizzy. So here's your call light, and I want you to call me if you need anything at all. Do you know how to use your call light? Yes? Okay, perfect. So let us know if you need anything at all. And I will also set the bed alarm to remind you that if you're getting up, to call us first and make sure that everything is okay. Also with your hydromorphone, respirations were good, so we can go ahead and give that. So we're gonna do your tuberculin, your TB test, and we're gonna do that because the doctor wants to rule out that you rule out TB, because you said you had a productive cough of yellow blood tinged sputum, so we want to rule that TB out because that's never fun. To have with this TB, we will be giving it to you in your forearm. It may cause a small reddened area. That's perfectly normal. But I need to tell you, do not rub or scratch the area because it can lead to a false reading. And we'll come back in 48 to 72 hours to do a second reading, but to check your injection site. We have to do it into that 48 to 72 hours. Those are very crucial. So if you get discharged before the 72-hour window, please come back and follow up within that same window after we get it, or we'll have to start the process all over again. Next, we'll be giving you insulin. As a diabetic, you know that your blood glucose of 191 is not in the range that we want it. We want it 60 to 110. So we will be giving you the insulin to decrease your blood glucose there. So with the insulin though, we will be watching your potassium, because if that potassium fluctuates after we give it, it can mess with your heart. So we'll pay close attention to that. Also, when we come in and reevaluate, we'll know that this insulin is working if your blood glucose has lowered and is in the normal range. Okay, so now I will administer my medications. First, I will give my patient a drink of water to assess that they can swallow. After I know that, I will be able to give my pills. But first, let me check again, do my third check. We've got our furosemide, 60 milligrams per tab. Okay, yeah. We've got our furosemide, 60 milligrams per tab, expires 6/23/2020, and we're giving 1 tab of that today. And then we have our aspirin, 81 milligrams per tab, expires 5/26/2020, given PO. Okay, tab daily, and these are all at 9. Oop, got started. These are all at 9 a.m. So all 9 a.m. meds, we will be given the hydromorphone, which is 2 milligrams per milliliter. Okay, checking. It matches, expires 5/26/2020. There you go, given IM. And then we have our PPD skin test. It's given intradermal, 5 tuberculin units per 0.1 milliliters given intradermal, expires 6/23/2020. I'll be giving 0.1 of those today. And then we have our our Humulin R, regular insert or insulin, 100 units per milliliter, and it expires 8/12/2020. We will be giving 2 units per sliding scale due to the 191 glucose. So, like I said, I will assess if they can swallow first. Then I will give the furosemide and have her swallow that. I will check to see if she's, check her mouth, make sure she's not keeping it in her cheek or tongue. And then I will give the aspirin. I will give the aspirin with food as well. And I will, the cheek, make sure she's not keeping it in her cheek or tongue. And then we have our hydromorphone. I will clean the area. I'm going to give this in the ventrogluteal. So I will put my left palm on the greater trochanter, and I will put my index finger towards the anterior of the iliac crest and my middle finger towards the tubercle of the iliac crest. I will make a V, and I will do it in the deep part of that V. But you can also give this in the deltoid and the vastus lateralis. So I will hold the skin. The skin will be held taut. Okay, we're giving it in that deep V, 90-degree angle, dart-like motion. I will insert. It is okay for the patient to rub this. I will get rid of this in the sharps container because you never recap a dirty needle. Okay, and then I have my tuberculin skin test. I will clean this site. Okay, and this, I will be giving this in the forearm. You can also give it in the clavicular or scapular area. Okay, I will do this, hold this 10 to 15 degrees. I will hold the skin taut, bevel up, and I will insert it just so it gets in there. I won't put the needle all the way in. I will insert that, throwing this in my sharps container. I will teach them, I will watch for the bleb as well. So watch, we have the bleb there. So then I will throw it away in the sharps container, and I will teach them not to rub or scratch the area because it will read a false reading. So then I have my insulin. I will make sure that her tray is on the way before she gets this regular insulin. We're going to give it, I will ask her where she last had this. You can do it in any of your fatty areas in the abdomen, but 2 inches away from the belly button. 2 inches away from the belly button, 2 inches away from any scars or tattoos. So you can give in the fatty back areas, the back of the arm, the thighs, love handles, like that. But we're going to be giving it in the right upper quadrant. And I will ask her where she last had it because it's important to rotate sites. So we're giving it in the right upper quadrant. Meals on the way. I will pinch here, 45 to 90-degree angle, dart-like motion, and I will insert. I will also teach not to, I will discard of this. I will also teach not to rub this this side because it increases absorption. So after this, I will document that right patient, right drug, right dose, right time, and right route of the med administration rights have been done properly, and she has received all 0900 meds. I will also record the ounces that she took when taking her PO meds to include that into her intake. else? I will then tell Miss Lano, thank you for cooperating today. We're gonna drop your bed into the lowest position and we're gonna lock it, put both side rails up. Here's the call light once again. Do you know how to use the call light? Yes, okay, perfect. And I will ensure her that she can call us for anything she needs, and there you go.